Eric Olson here, KSMQ Public Television. Joining us now is Sue Yost. Sue is the Director, CHS Administrator, Freeborn County Public Health. We're going to get a COVID-19 update on our region and Freeborn County. Hi, Sue.
Good morning. How are you today?
Hey, I'm all right. And looking at some numbers just came out today, April 20th, courtesy of the Minnesota Department of Health. Star Tribune, looking down the latest numbers. Olmsted County there, you can see leading the way, high population. Winona County had quite a jump, 61 cases, 10 deaths. Freeborn and Moore, 34 cases, Freeborn 27, with Moore County 23, Blue Earth. Fillmore County 10 cases, Steele County 9, and Faribault County 4. And fortunately for all of our region, Sue, no deaths. Is there anything to update the situation that you can share with us in Freeborn County?
Well, we've been fairly busy here. Our cases, we started about 2 weeks ago, and our cases have really, what I would think is jumped. Over the weekend, we had 6 more cases. There was no cases reported. We've had some days where there's been no cases reported, but most of the time we've had some cases reported, unfortunately. So over the weekend, yeah, we had 6 more cases, and unfortunately we're continuing to increase with numbers.
Were those all, do you think they were in the same location? What do we know about them?
Some of the cases are connected and some of them aren't. And so, but I think the majority of them are connected to like 3 or 4 different situations. So, but we're hoping that we can get those under control and be able to slow this thing down.
I guess for me anyway, there's a lot of anecdotal observations I make in my routine to shop and to go around. I see it's probably here in Moore County, I'm guessing about 50% of the folks I see with face masks on, like at the store or whatever, and social distancing, maybe a little bit higher percentage than that, but certainly not 100%. What are you seeing? And I know this isn't scientific, so a person like you probably doesn't like that because it's not science, but what does it look like as far as participation, cooperation in Freeborn?
Well, let's put it this way. This is my observation. I've observed that traffic is definitely down, so people are trying to stay home as much as possible. People are definitely out wearing masks. I've seen people wearing masks, and I've seen people not wearing masks. So, it just is a matter of, were they able to get a hold of a mask? Maybe they'd like to be able to wear a mask if they are out and about. Restaurants are definitely quieter, even drive-up pickup. Of course, nobody's eating indoors at the restaurants, but they're definitely experiencing a huge slowdown for the restaurants.
Sure. I've heard it's like about half down, 50% from the restaurant owners I talk to.
Really?
But many people are doing their best to try to order takeout, I know.
Yeah, want to support them.
Yep, absolutely. Now the masks, it's confusing to me anyway. What is the latest advice? Is there a recommendation, yes or no, for them?
There is a recommendation for the general public to wear a cloth mask of some kind, a bandana, some kind of covering, but a bandana should be formed around the face. If it's just folded and hangs down on the lower part, if you would cough or sneeze, the stuff is going to come out the sides. So it should be form fitting around the face so that it can help block any liquids, fluids, whatever, from flying.
And interesting, in a chat with the Mayo Clinic doctor last week, he indicated that there's also a benefit because of the individual wearer. It keeps them from touching their nose with their hands. There's sort of a physical barrier there too.
Yeah, there is a physical barrier, but also people tend to play with the mask a lot to try to keep it in place or put it back in place. And so I think it can be a little bit of both. So that just makes it somewhat challenging that way. I know when I've worn a mask, I talk and then it moves, and so I'm readjusting it.
And Freeborn County is really out in front. I know the governor has talked about has a mask day coming up where everybody can drop off homemade masks to the fire department. I think that's the 25th, if I'm not. But Freeborn County, you are already doing something similar. Why don't you tell us about it?
Yeah, we started with United Way of Freeborn County that we're collecting masks so that we can probably get them out to those that need them that are working in the healthcare field. We started that about 2 weeks ago, and so we have volunteers that are making masks, and they've made some absolutely beautiful masks, and so it's kind of fun to look at them all and be able to give them out to people so that they can be able to protect others. And the masks are not to protect you, but they're to protect others so that you don't spread anything that you may have, because they found that some people may be spreading it even before they realize that they have the disease. They could be asymptomatic.
Finally, Sue, how are you dealing with this and your staff, helping them with self-care, not just about COVID, but just the stress of being a medical worker in these times?
And yeah, it is very stressful. A third of our staff is working from home, and so they get very lonely working from home, and they're connecting with their families through telehealth, by phone or by video. And so we connect with them on a daily basis so that we make sure that they're taking care of themselves. If they have any needs, we're connecting them. If they, mental health needs, connecting them with those resources, connecting them with any resources that they can do to be able to take care of themselves. Making sure that they're even getting up and getting dressed, showering every day, things like that. That all makes a difference too.
And for folks still not sure in Freeborn County, should they call you if they think they have symptoms?
Actually, if they think they have symptoms, they should call the medical center. So the number is 507-668-2121. And that's the triage line for COVID with the medical center here in town. And they will help them determine if their symptoms that they're having qualifies them for getting tested.
All right, and that's Freeborn. Anybody in Freeborn County.
Anybody in Freeborn County. I don't think you even necessarily need to live in Freeborn County, but.
Okay. Well, thank you so much for your service, Sue Yost. And thank you for joining us.
You're welcome.
We've been chatting today with Sue Yost, Director of Freeborn County Public Health. Continued health, and thank you for fighting the good fight there. For now, I'm Eric Olson, KSMQ Public Television. Thank you for watching. We'll see you again soon.
Thank you very much. Have a good day.